There we go. Hi,
it's really funny, Victoria. Other Victoria. Okay, go ahead.
If everybody in the chat, we do see that there's 66 folks online. Can you just let us know, somebody, that you can hear us okay?
And I'll just talk as well and make sure you guys can hear me as well, okay?
Getting lots of messages that's saying everything is good. They can hear us both.
Okay, great.
Sorry, everybody. We're testing out new webinar technology. So Andrea and I have just been, you know, trying to navigate all the challenges that poses. So I just wanted to... Go ahead, Andrea.
I was just going to say, just so everyone knows, this is being recorded. So if you need to step away or anything, we will have the recording after the webinar as well available to folks. So I'll let Victoria to get us started.
Sure. Thanks, everybody. I just wanted to direct a couple of things to your attention. I'm hoping everybody can see what I see. On the right-hand side, there's the chat bar. So that's where you can sort of chat amongst yourselves. Towards the bottom, there's a questions section. So if you have questions about the webinar, you can pop those in there just so they don't get buried in the chat. Andrea and I will be able to see and access those throughout the webinar. Otherwise, everybody can see slides okay. We're sharing our screen. Just someone let me know in the chat if slides are available to all of you. Perfect. Amazing. So thanks everybody for being online today. I'm so excited to co-present this session with Andrea, who has been a huge mentor and model for me as I've sort of begun my journey into children's grief. I'm Victoria Pileggi. I'm the Research and Evaluation Coordinator with the Children and Youth Grief Network, and sort of managing and overseeing our new research project on working with marginalized groups in grief. So that's sort of me, and I will talk a little bit more about the network. Andrea, why don't you introduce yourself?
Absolutely. So my name's Andrea Warnick, and I spend my time basically divided between working with awesome organizations like the Children and Youth Grief Network, doing a lot of consulting work, doing a lot of private practice with families who are sort of in the trenches of their grief, and also doing a lot of education. And so one of the things, anybody who's ever been to any of my education sessions knows is that I'm passionate about resources. And so I'm really excited about this webinar today. It's really different than any of the webinars that I usually do. And I'm really excited that it's an opportunity for Victoria to share the research that she's doing, because
just check that your audio is on, that you're using your computer built-in speaker
to be on top of the research and to amalgamate the research. And
people are saying yes for both, no problems here. And in terms of the slides, yes, on your screen the slides should be above our heads. Andrea and I are at the bottom.
Half of the webinar is really going to be about sharing resources. And just to make clear, we're not in any way suggesting that this is a completely inclusive sort of look at what resources are out there for grieving children, youth, and families. I've really just pulled together a whole bunch of my sort of favorite resources that I often refer to, because we will make sure that this webinar is free, that it's available to people. And so that people who are looking for resources, whether you're here as a professional or as a family, will sort of know what some of our favorite resources are. But again, there's a ton of other really good resources out there as well. This is just sort of our best of. So I can see a whole bunch of conversations happening about people not seeing the slides, or seeing the slides, or hearing me and not hearing Victoria. And so I'm the only person talking right now. So I'm hoping that everybody is actually hearing me okay.
Perfect. Thanks, Andrea.
Can everybody hear me? I'm just going to do a sound check again. Is everybody able to hear me okay? Okay, so a bunch of people. And then Victoria, why don't you just talk for a second? We'll make sure everybody can hear you okay. And so I'm going to actually let Victoria take over here. So I will be muting my microphone. I will be just turning my camera off, sitting and enjoying my tea and listening to Victoria as she shares with you the update about the research for the first 25 minutes or so. And then I'll take over for about a half an hour, sharing my sort of favorite resources. and then we'll just open it up for Q&A from everybody. And again, this is a new platform that we're really experimenting with. One of the things that we figured out is, as the co-host, I can't actually be like controlling the slides myself. So I'm going to have to be sort of asking Victoria to advance the slides for me and everything else. But everyone should have access to them. And we're also, while there isn't a place where you can download them, we're also happy to email them out to anybody who wants them as well. So, and maybe what we'll do is just send them out to the whole list. So I'm going to let Victoria take over, and I'll be back in about 25 and a half minutes or half an hour. Thanks, Victoria.
I'm going to start moving us forward. So like I said, the first little bit of the presentation will focus on our research project, working with marginalized grieving youth. Before we get into that, though, I just wanted to share with you a little bit of the research that we've been doing with the network, and a little bit more about the network itself. So for anybody who's not familiar, the Children and Youth Grief Network is a group of organizations located in Halton, Peel, and Toronto that collaborate essentially to increase awareness of the needs of grieving children and youth. Our vision is that every child has honest information and well-informed support when they're grieving the death of someone that they care about. And our mission, obviously, is to advocate for education and support opportunities that benefit children and youth who are grieving. So on the slide here, I've put our network partners currently. So as you can see, Andrea Warnick is one of our wonderful partners, and she's been a great advocate for the mission and vision of the network. And we're so grateful to co-host this webinar with her. Also want to just flag some of our other partners. We do work alongside Dr. J Children's Grief Center in Toronto, Bethel Hospice in Peel, Carpenter in Halton, Dorothy Lay Hospice in Toronto, Family Education Center in Peel, Elizabeth Doherty, who works in Halton and Peel, Lighthouse, which is located in Oakville, Heart House, which is in Mississauga, and Acclaim Health, which sort of operates all over the place, but Peel and Halton. I'm so sorry for everybody who still looks to be having some audio problems. People are saying to try turning permissions on. I'm not sure if it's a browser issue, but we will send out all of the slides after the fact, so you will have the information anyway. Apologies again if you can't hear us. So our team, I'm not sure why the Heart House logo hasn't popped up there, but we are led sort of steadfastly by Julie Pahar, who is the network director and has been since sort of the beginning. Tori Hagerman, who I believe is online somewhere, is our communications coordinator and handles all of our day-to-day communications with partners and community sort of network members. She also manages our Facebook and social media feeds. And then there's myself, who, like I said, research and evaluation coordinator, does all of the impact data for the network and any external projects such as this one. We're led by Heart House Hospice and Family Education Center together. They are our lead agencies and sort of act as the executive committee for the network. So some of the research that the network has done in the last couple of years is really getting a good grasp of how many children are grieving in Canada and Ontario. So using the 2016 census, which was our last sort of full scope of who is living in Canada, we learned that approximately 106 million deaths occurred worldwide. 267,000 of those approximately occurred in Canada. And that translates to almost 100,000 deaths in Ontario in that 1 year. If we then look at what the impact is on the children in Canada, Ontario, and some of the regions that we work in, we've used the Canadian Census algorithms to determine that in Ontario alone, approximately 77,000 of the 2.8 million children living in Ontario were bereaved in 2016 alone. So just keep that in mind. That's in 1 year. That's not a total number. And then if we translate that into Toronto, Peel, and Halton, you'll see that in Toronto, approximately 13,000 are bereaved each year, in Peel, about 5,000, and in Halton, almost 3,000. The purple bars are the number of children under 18, and the blue towards the bottom is the number of bereaved children. So if we're looking at those statistics, that translates to about 1 child in every 50 in Ontario, and approximately 13 children in every school in Toronto, Peel, and Halton being bereaved each year. If you're thinking that, breaking that out into classroom sizes, that's approximately 1 child in every other Ontario classroom who will experience the death of an immediate family member in 1 school year. So I know Andrea is going to walk us through a ton of different resources, but we did want to flag our newly updated resource map. You will be able to find this on the Children and Youth Grief Network website in the next couple of weeks. Here we've just flagged some of the different resource formats that you might be looking for or interested in, and all of our partners who offer this on their websites. So there's just two we wanted to sort of highlight specifically. In the tip sheet section, you'll see that Dr. J's, Heart House, and Lighthouse all have a number of tip sheets available. Family Education Center partnered with the Children and Youth Grief Network last year to create 4 different tip sheets that we just wanted to flag as being available in 7 different languages. So you can find those on the Family Education website. We also have webinars, videos, podcasts available. Andrea is going to walk us through quite a few of those. So don't fret if you can't read some of that text. I appreciate it's quite small. We also have courses, book lists, and Lighthouse's annual conference that happens every November. You see the red box there over the courses. This was a new initiative that we just wrapped, I guess, late last year with Family Education Center as well. They do a lot of e-learning courses, and we were lucky enough for them to feature an e-learning course on parenting grieving children. So you will be able to access that through their website and refer any caregivers that you might be working with to that course. We're very proud of it. So I just wanted to, again, look at just some of the chats that are coming through. People are struggling with audio intermittently. Yes, this will be available as a download. We're hoping that the audio will be okay in the recording, but we will send out these slides to everybody just so you will have them. And thank you for people who are responding to that. So I just wanted to introduce to you the Crossroads of Grief project, which is sort of our baby for the last year or so. I guess a few years ago, we applied to the Ontario Trillium Seed Foundation to sort of get a little bit of money to look into the experience of grief as it overlaps with social barriers like low income, racialization, immigration, disability, sexuality, incarceration, etc. A lot of our network partners were interested in hearing and learning more about the impact of grief in these communities. So we applied and were successful and have structured our project in 3 phases. So as you can see from the slide, phase 1 was literature reviews. So we did 1 literature review on children's grief in general, and we also did 1 on marginalization and grief. Phase 2 involved interviews with both grief and non-grief specific organizations, learning a little bit more about their experiences working with marginalized groups, their needs and their capacity to do so, and a little bit more about what could be produced or created to support work with marginalized groups. And then the third sort of phase is where we're entering now is the exchange events. So sharing all of our learnings from this project with clinicians, healthcare providers, educators, and family members. So inadvertently, you are all part of the knowledge translation and exchange event phase. So using those 2016 census numbers, as I mentioned, 77,000 children in Ontario were bereaved in 2016 alone. Then when we use some of the statistics from across Canada, we can sort of estimate that looking at marginalized groups, 17,000 or so of these children are visible minorities. 12,500 or so identify as newcomer, so either immigrant and or refugee. 3,800 are Indigenous identified, 8,700 almost personally identify as members of the LGBTQ community. This does not include children who are members of an LGBTQ family, so do keep that in mind. 3,000 or so children are living with a disability, and 7,000 are living in low-income households. So if we take this all together, understanding, totaling up those numbers if you wanted to, we understand that the majority of bereaved children in Ontario are marginalized in one or more ways. So keep in mind, this doesn't account for any intersection of these minority groups. There's no overlap sort of being taken into account here, which we know is often the case. So just looking at the way the project has been broken out, phase one, as I mentioned, was the literature review phase. Andrea Warnick and Barry Ashpole were so gracious to lend us their services and conduct a very full and complete literature review on grieving children and the information available on children's grief and bereavement. They reviewed 150 articles, and sorry for the typo there, dated 2015 to 2018, so it is very up to date. And it explores topics related to children's grief, including pre and post-death considerations, long-term impacts of grief, programs, interventions, assessments, and education programs available. This will be posted to our website, the Children and Youth Grief Network website, in early June 2019. So do keep your eyes out for that. And then the second part of the literature review is the one that I've completed on marginalization and grief. So to date, I've looked at approximately 52 articles, and that's exploring grief in minority, newcomer, LGBTQ communities, low-income communities, Indigenous and disabled communities. So significant learnings that we've sort of gleaned from this literature review phase. We do know that literature on grief is expanding rapidly. You know, in the last 3 years, there has sort of been an explosion of literature that is looking at grief and bereavement in general. However, far less is being published on grief in children and youth communities. So they are still very much considered lost and invisible mourners. The other thing that we wanted to flag for you is that literature on marginalized groups is often one-dimensional. And that means that when we're looking at grief in certain groups, we're really only focusing on one type of experience. So in racialized groups, for instance, we're often looking at homicide and violent death. In disability communities, we're looking at usually the capacity to understand death and grief. And in Indigenous groups, the focus is primarily on suicide. And that's a bit problematic because we know that cancer, long-term illness, and lots of other grief experiences impact these communities, but we're really not understanding very much about that. The other thing is that marginalized groups are not represented in studies that explore and develop assessment tools and program impacts. So you know, we really are basing theories, conclusions, measurements, interventions on non-diverse samples. And that's sort of inappropriate because we don't know what the effect of these will be in wider and more diverse groups. The other thing is there's very little discussion of how marginalization intersect and influence one another in the grieving process. So we can't think about these things in isolation. We need to think about how they interact, which we will get to in a few minutes. Just want to take a minute and look at any of the questions that are coming in. Someone mentioned how traumatic and violent deaths are addressed. I'm not sure if you're talking about within the project. Not sure if someone wants to just clarify that in the chat for me. Okay, I can wait for a few minutes and we can come back to that question, but hopefully later on in the presentation, we maybe cover some of that. So just wanted to flag for you that, you know, in sort of ignoring marginalized groups in the literature, we are sort of contributing to the idea of disenfranchised grief. So for anybody who may not be familiar with the term, a disenfranchised griever is someone who is grieving a loss that is not publicly acknowledged, mourned, or supported. It's not a socially validated type of death or grief. The reasons for disenfranchisement are wide. The loss may not be seen as worthy of grief. The relationship itself may be stigmatized. The mechanism of death is stigmatized. The person grieving is not recognized as a griever, and the way someone is grieving is not recognized or is stigmatized. So understanding that, you know, we're only looking at certain mechanisms of death in certain groups, we are stigmatizing other types of death. We are stigmatizing the way that people grieve in those communities, relationships and things like that. And this creates a really negative feedback loop. So the more we disenfranchise people, the less likely they are to access forms of formalized support, which in turn then increases disenfranchisement within those groups. So some recommendations that have come out of reviewing the literature, there's threefold. So the first is an health equity approach. So we understand, I think, that some people face additional obstacles or require more and different types of supports to achieve the same level of health as other people. Some of the barriers that have been mentioned in some of the marginalized groups within the literature include accessibility of service, so cultural incompatibility, long wait times, complicated services, lack of representation within service providers, and inconvenient hours. Other things include, insufficient time with providers, time and social distance from providers, cost of service, transportation to service, insurance considerations, language barriers, stigma, fear of medicalization, fear of status implications, and fear of child welfare implications. So as service providers, we need to really be focusing on, the health equity approach and striving to reduce health inequities, removing barriers, and creating equitable opportunities. Another recommendation comes from this intersectional approach. We really do need to recognize that we all occupy multiple identity categories at the same time. These categories overlap and intersect in really unique and unpredictable ways. And so it's really hard for us to say, a female identified person living with a disability who also identifies as racialized, this is what grief is going to mean for them. We really do need to focus on how the person experiences grief, their worldview, their perspective, and understand that these come together in really, really personal ways. There's no way to predict these things. So quality care is not one-dimensional. It needs to be fluid. It needs to be responsive to the needs of all of our clients. So in our work, we need to take into account the social location of all people to understand what grief and loss means to them and what barriers may exist to accessing formal and informal grief support. Another recommendation is a community approach. So one of the things that really stood out to me and to Andrea and Barry in the literature review component is that, due often to barriers associated with the social determinants of health and experiences of marginalization, communities of difference are far more likely to access informal communities of grief support. And that includes religious communities, cultural groups, prominent community leaders, and friends and family. And so as formal organizations, we really need to be collaborating more effectively with these groups and communicating our intentions, informing our practices through conversations and interactions with these groups so that we can normalize conversations about death and grief. Just looking again quickly at the questions. So traumatic and violent deaths were not necessarily addressed only or sort of individually, independently in the literature review that I've completed. Andrea, I'm not sure if you are still tapped in, but maybe you want to speak a little bit to how traumatic deaths were spoken about in the literature review on children's grief and bereavement that you and Barry completed.
Yeah, I think, they were touched on. There wasn't a deep dive. We'll also be releasing sort of a summary of the literature search, which will make it quite easy for anyone who doesn't want to read all of the literature in there to sort of see where the gaps were and things like that. It sounds to me, though, I'm wondering, Lorna, if you're actually asking more about directly how to support kids as well who are grieving sort of more violent, unexpected deaths. And we will, when I go through my section on resources, because we are going to be cautious about not sort of going along the route of having this be a webinar about strategies and everything per se today, but really focusing on what
Vanessa
resources
around
are actually available. And I will make sure
focused.
there's a number of resources.
I know for myself, I tried to find as much Canadian literature as I possibly could, but in my case around marginalization, the majority of articles were coming from the United States and from the United Kingdom, which tend to be a little bit more advanced, I think, in their literature on grief and bereavement in general. Andrea, what about your literature review? Where were the majority of articles coming from, if you can recall? So hopefully that answers some of the questions.
Yeah,
do keep them coming. We'll try and bounce back and forth between the content of the presentation and any questions that are coming through.
States for sure, but we did go worldwide, right? I know that a lot of there were some pieces on school and grief support in school. A lot of, Denmark is very much on the forefront of that. And so we really went, like, we didn't exclude anything really, but it would have definitely been heavy on the UK and the United States.
So phase 2 of the Crossroads project involved both interviews with our CYGN network partners. That phase is sort of complete. I did qualitative interviews with questions that explored partners' experiences with and capacity to work with marginalized groups and their needs and hopes to improve service accessibility. The second phase of this sort of larger phase was surveys with community organizations who work specifically with marginalized groups, but in non-grief specific ways. And those questions for that survey explored how grief impacts their work with the community, barriers that they face to accessing grief support more formally, and what groups need from us as the grief experts to do their work more effectively. So I analyzed all of the data that came through from both of these collection sort of methods and identified themes within and across the groups. And so what we found, some significant learning. So first and foremost, opportunities. I wanted to really highlight the fact that for our partners and for a lot of our community organization, community members, cultural humility and a client-centered approach were of utmost importance. So it's highly valued, highly prioritized in work with clients. People really did try to adopt a teach me approach and learn what grief meant to their clients and how it impacted their worldview. For anybody who's not necessarily familiar with a cultural humility approach, I just wanted to include a little bit here on the slide from the First Nations Health Authority. So really focusing on self-reflection to understand any personal and systemic biases that somebody might have in their work, and really acknowledging yourself as a learner rather than the expert when it comes to understanding someone else's experience. So it's really an approach based on asking questions and collaborating with the person that you're working with, and not presuming that you understand or know everything there is to know about the person sitting across the table from you. So with that said, those were some opportunities that presented themselves. However, some obstacles that really did come to the forefront for us was this idea of non-representative clientele. So despite those really large numbers that I spoke to earlier on in the presentation around marginalization and grief in Ontario, a lot of our partners are not currently tracking demographic information related to clients' social identities. And when they do, diversity amongst clients remains extremely low, with numbers that are not necessarily reflected of the national and provincial estimates that we saw. There is an assumption sort of within the partner organizations and within the community that marginalized groups do receive grief care and support in informal ways, and that there maybe is a little bit of a limited awareness or knowledge of the formal programs and services that are being offered. The other limit, which I'm sure lots of people can identify with, is resource scarcity. So very precarious funding for the sector limits the amount of research that can be done, the number of staff that can be hired to, really manage or take charge of working with marginalized groups, and the quantity of programs and services and resources that can be available and made available in the future. So some recommendations that have come out of that phase, first and foremost, is knowledge exchange with community. So again, taking that community approach, really engaging reciprocally with community organizations. So not only sharing what it is that we do, but really learning about what grief means to these communities, how they are serving the communities of grievers in their world. Together, this can boost cultural humility and sensitivity. So really, we can educate ourselves about what grief looks like. We can support an understanding, a much wider understanding of children's grief and bereavement, and increase their familiarity with grief-focused organizations. Doing so, like really meaningfully engaging with communities, can also allow for some great review and understanding of the community's needs. What do they need from us? And we can also bolster in that way the community's ability to support children's grief. The other recommendation that is coming out of this project is more accurate and intentional demographic tracking. So partners need to consider reviewing intake procedures to more fully capture and track client diversity and understand who is being served. This will allow for much more effective strategic planning and decision making. Some of the considerations, specific examples and ways that this can be done is incorporating intake questions with the needs of clients, allowing them to share with you their previous experiences of programs and services, what was effective, what was maybe not as effective, and barriers that they've had to accessing both your service and other services that they've tried. Another consideration could be conducting exit interviews with clients to determine if their needs were met through your service, what was missing, and ways that you and your organization could have been more equitable in your service provision. And then finally, the last recommendation to come out of this phase is a real commitment to diversity and inclusion. So understanding that budgetary and resource limitations are very real. We do understand that very intimately. However, these can be experienced as further marginalizing for certain groups, as it does sort of communicate an unwillingness to consider their needs or modify the services appropriately. So we do ask and sort of urge communities and organizations to get creative in establishing budgets and using the personnel that are currently available, taking small steps to make sure that programs and services are accessible and sensitive to groups, and are really taking that cultural humility approach in your work. So it does, take a bit of a commitment. It may not come easily for sure, but just understanding that it isn't enough to say, well, we don't have the money and we don't have the time. Really striving to do our best to include everybody and approach our work in a diverse way. So Andrea, I think that's all we had from the presentation on my end. We'll transition into some of the resources that are available, but I'll be available via audio and camera if anybody
Thanks so much
for questions or anything. Thanks, everyone.
Victoria, it's so great just to be able to have Victoria's brain involved in the literature and actually pulling it all together in the way that people like myself, who is not an academic, can actually understand. So we thought it was really important to sort of bridge these two pieces together. One of the reasons that I was actually drawn into this work is because we had a situation in my family, like 30 years ago now, when my aunt was dying of cancer and never actually told her kids. And one of the things I constantly reflect on is the fact that at that time, we didn't actually have research to say what best practice is and what will most benefit kids when somebody is dying or someone has died in their life. And I think of how far we've come in the last 30 years, where we now actually have a strong body of literature. But one of the things that's actually, when Barry and I were doing the literature searches up to 2015 as well, because there is on the Children and Youth Grief Network, right now, the literature that was amalgamated up to 2015 is available to anybody who wants it on that website. And the thing that really stood out to me is that even though it's very clear in terms of a general, of course, there's going to be differences depending on the family and everything else, but in general, that kids benefit from honesty and inclusion when somebody's dying or is ill, that information hasn't actually made it to the front lines. It hasn't made it to the front lines of our schools, of our healthcare systems. It certainly hasn't made it to families. So there's a big knowledge gap. And that's why I feel so passionate about presenting and educating, and that this is such a social justice issue, because as Victoria talked about in the research as well, that there are communities of people who are not likely to actually reach out for more formalized support. They're going to go to their churches, they're going to go to their synagogues, they're going to go to their communities, but it's going to be more informal grief support. And that's why we really need to make sure that the literature and the research that's really supporting what best practice is with supporting grieving kids is available to everyone. So I'm going to just run through some of my favorite resources. For anyone who's joined us more recently, just know that we are not even trying to say that this is a totally inclusive sort of representation of the resources that are out there for grieving kids. We've just tried to amalgamate really some of the resources that I really love and find that I refer to quite a lot. Victoria is going to be going through the slides for me, so I apologize, but I don't have control of them on my end, so I'm just going to ask her to keep turning the slides. So let's go to the next one, Victoria. So we're going to start with supporting kids before a death actually happens. And I find in general, there's a lot more resources available for kids after a death. More communities are likely to have bereavement groups. Bereavement very much speaks to the state of somebody after a death has happened. Grief groups, which might be inclusive also before a death has happened, are not as common. Grief organizations are not. I know that in the Southern Ontario area, it's often connected to hospices. Dr. J Children's Grief Center provides grief support before a death. Certainly the HUG program, Help Us Understand Grief, in Halton and Peel. We've just launched the Nightingale Center in the Wellington region, and so we're really working on bringing grief work before a death as well. But in general, there are much bigger gaps, I find, for when it's an expected death. And I believe, and Victoria, you probably have a better pulse on this than I do, so you can correct me if I'm wrong, but I do believe that in Canada and the US right now, it's about 90% of deaths are expected deaths. So an illness, it's something where we know it's actually coming. And so I think it's really a big gap that we don't have more support for before the death happens. Winston's Wish is the one who actually produced this book here, As Big as It Gets. Winston's Wish will being a recurring theme as I go through my favorite resources. The Winston's Wish and the Dougie Center, which is in Portland, Oregon, Winston's Wish is in the UK, are two of my favorite organizations. Like, anything they produce is good. So they've got all kinds of resources. I'll only be touching on a few of them, but I really do like the book As Big as It Gets by Winston's Wish. This, unfortunately, is not a free resource. I've tried to prioritize free resources in this webinar, but there are some books and everything that do require purchase. It's good to keep in mind, because Winston's Wish is in the UK, and my guess is most of us online are not in the UK, that their books can be obtained quite a bit cheaper just through Amazon.ca or Amazon.org as well. And actually, on that note, I'd love to just get people who are online with us to throw into the chat box like where you're actually coming from today, so we can get a pulse on that too. And Victoria, if you want to go to the next slide, that'd be great. And so there's a number of places that we can go to find out how to explain cancer to kids. And so I've included a few of the websites here. I know the US Cancer Society also had, the American Cancer Society also has tip sheets on this. Start the Talk is for educators and healthcare providers. There's actually two different trains you can take. One is if you're an educator, and the other pathway is if you're a healthcare provider. It is in French and English. Telling Kids About Cancer is a US website. It's a bit dated now, but it does do a pretty good job of sort of walking through what cancer is. I find that Kids Health is a great resource for, there's a section for adolescents, there's a section for kids, and there's a section for parents. And it might be, what is cancer? What is depression? There's so many different things. So those are sort of four of the places that I often go to for resources on how to talk about cancer. Go ahead to the next slide, Victoria. And I can see, okay, so, oh, wow, we've got someone from Pakistan here. That's amazing. Louisiana, hi, Denise is here. Great. So we've got a lot of people coming from, Ontario, US. This is great. So I do need to say, I don't think we've got anyone from the UK. One of the things about the UK is that I really find that one of the resources that they have, which I really wish we had in Canada and the US, is they tend to have hotlines throughout the UK, which are free phone lines that any person supporting a grieving child can call. So you may be the child's babysitter, you may be the child's grandparent, parent, educator, you could be a healthcare provider, but you can call and actually talk to a trained children's grief counselor. Most certainly Winston's Wish runs one of these hotlines, but there's a number of organizations that do, which I think is absolutely phenomenal for capacity building. I dream of a day that we have that in Canada, and certainly the US. Now, the US does have, this is specific to schools, but they do have a similar resource for any schools who are trying to figure out how to support a grieving student in the school. So I will talk about that in a moment. This is a video that I have on my website. It's a free video. It's just up under the video sections on Andrea Warnick Consulting, and it's about 40 minutes, and it's really talking through how do you talk to kids about cancer, but it includes how do you talk to them about an impending death. And I find certainly the case in Canada is that Any child in the public school system knows about our national hero, Terry Fox, who died of cancer. And so I find that in Canada, kids sort of from the age of 4 on really associate cancer with the possibility of death. And that's why, even when I'm working with families who it's a cancer diagnosis that may not end up in death, I still think it's important to prepare families for how to have the conversation in case the 6-year-old does say, well, are you going to die like Terry Fox? Probably worth doing that around across the board, no matter where you live in the world. But I do find it is on kids' radars sooner in Canada as a result of that. Go ahead to the next slide, Victoria. So in general, I find that cancer tends to be quite well resourced when it comes to resources. This is one that a client told me about recently, and I've been super impressed with. Free to download it at the App Store. It is from the UK as well. But it's a kid's guide to cancer, and it goes through radiation, chemotherapy, a whole bunch of questions. I believe it also sort of addresses some of those common concerns. Did I cause it? I know it addresses you can't catch it. So one of the reasons I always tell people, don't just say mommy's sick, mommy's sick. They have no way to differentiate that between, that and a cold or something like that, which most sicknesses kids know about are contagious. So I like that this Kid's Guide to Cancer really does address the you're not going to catch it for anyone, but it addresses a whole bunch of other things too, and it can be downloaded right onto your tablet or your phone. Go ahead, Victoria. Now, at ALS, I find there aren't as many resources for. I just pulled these off. These are 2 that I use. They're on Canadian websites. The US may have more resources as well, but ALS 411, a bit dated, but it has some good info both for children and for teens. And then the Canadian ALS.ca website as well has a number of tip sheets for youth and children on talking to people about ALS. So those are sort of my go-tos for ALS. Next slide. So these are some resources we're going to go through, as I just went through the ones that are sort of pre-death, more specific to illness. And these pieces are talking about more death and dying and often after a death as well. Next slide. So Living Dying, a close colleague of both Victoria and mine, Kaylee Eaton Russell, wrote this a number of years ago. Great little handbook that, I want to say it's only like 40, 50 pages, and it's available right on the Dr. J Children's Grief Center website. Next slide. Dr. J Children's Grief Center website also has fabulous tip sheets. So I've included here just the one talking about illness and dying. They've also got one about funerals. They've got ones for preparing kids for Mother's Day, preparing kids for Father's Day. I think those are so important. How do you prepare kids who have had someone die in their life before the holidays come? This is a bit of an aside, but one of my most favorite activities to do, and I do it in my individual practice, but certainly is something that the Dr. J program has just run with, is heading into the holidays. We make sure it's very non-denominational, usually early December, but doing a holiday activity where all the kids are invited, all the families are invited who have had a family member die. I'm always careful not to use loved one, because I've become very clear in my practice that relationships between family members aren't always loving, and it can be extra challenging for the ones where it may not be a loving relationship. But certainly any kid who's had a family member die, the families are invited to come together. When we first started this at the Dr. J Centers, I used to work there a number of years ago, we had like 2 families, and it just grew and grew. And now I believe there's more than a couple hundred people who come every year. But the families make gingerbread houses together. And there's little strips of paper and they say on them, like, I wish, I miss, I wonder. And it really just invites the family member to write their memories and their wishes for the person who died. And so we encourage them to put those memories in the house. Every family makes a house together, and then as they're eating the house, they can actually take out and share and read each other's memories. But it's also an opportunity to do psychoeducation on, how do you prepare for doing the holidays, because we know that can be such a difficult time. A number of organizations do have great tip sheets on, surviving the holidays or getting through the holidays when somebody's died in their family. Next slide. KIDSGRIEF.CA is something that we launched through Canadian Virtual Hospice about 1.5 years ago now. This is actually designed for families, but very applicable for anyone supporting a child who's grieving. Lots of video content, lots of written content as well, but basically walks through supporting kids through a variety of deaths. It may be an expected death, and it goes into the nitty-gritty of how to prepare a kid who's going in and they're seeing grandma, as she's in her last days or hours of life. How do you explain respiratory congestion? How do you explain that dad's not eating anymore? He's dying because he's got his illness, right? He's not eating because he's dying. He's not dying because he's not eating. So it covers all those nuances as well. It covers suicide in Canada and certain parts of the states, Portland, Oregon being one, or Oregon being one of them. It also talks about, medically assisted deaths and how to explain those to kids as well. So that's completely free to anyone in the world can access KIDSGRIEF.CA. What we haven't launched yet, but we will be launching within the next year, is KIDSGRIEF.CA for educators. And this will be content from this specifically tailored towards educators. Next slide. And from that as well, I mean, this is not quite the Winston's Wish hotline that's available to anyone, but in an effort to make sure that some free advice, well-informed advice, is available to families, again, anywhere in the world, being conscious that a lot of people do not have access to any specialized children's grief support. Virtual Hospice and I launched a number of years back now, where it's just one Tuesday, usually the first Tuesday of the month. This case, next month, it's actually not the first Tuesday. I think it's the third Tuesday of the month, but it's certainly up on the Virtual Hospice Kids Grief website. And so it's just me sitting there on a webinar platform, and a platform similar to this, but one that I know how to navigate better. And it basically, people can ask their questions from anywhere in the world. And I find that it's usually pretty 50-50, a lot of healthcare providers, educators, and a lot of families who are directly just looking for some guidance on how to support their kids. And we record it, so anyone who can't come live is also welcome to email their questions in. I'll respond to the questions, and then we'll send them back. Next slide. Another piece, now this is only open to Canadians, but Canadian Virtual Hospice also has Ask a Professional, and that's where anyone within Canada can just plug in a question, any sort of medical, grief, psychosocial question related to hospice, palliative care, serious illness, and a professional will respond within 3 business days. This is totally free. If it's a medical question, a nurse or a physician is going to answer. If it's a psychosocial question, one of the counseling team. If it's specific to kids, psychosocial, it'll probably come to me. So again, within 3 business days, people will get a confidential response that will be emailed right to them. Next slide. And I just included here a couple of my favorite kids' books. I mean, both of these books, they say, are generally for 4 to 8-year-olds. I've used both of them for kids much younger. I find When Dinosaurs Die, because it's a little bit like a graphic novel, like some older kids are into it as well. But great books, sort of introducing the concept of death. Lifetimes is a gentler introduction to death. And so When Dinosaurs Die is my absolute favorite. But I know some families get a little concerned because there's a section on poverty and suicide and homicide and things like that. And so some families feel like, well, I don't necessarily want my kid to learn about all of these things right now. I always take the approach that way better for your kid to learn in a safe environment of you guys reading a book together than anywhere else. And most certainly for the youngest kids, if it's not applicable for them, it's easy enough to skip those parts. So When Dinosaurs Die is really my go-to. I wish this would be on like every hospital unit, every family physician's office, in every school library. But we've got a ways to go. But Lifetimes is a beautiful book too, and a gentler introduction to death. Next slide. And I've included just a couple other books here. I mean, Tear Soup is a classic. I actually find that Tear Soup, to be honest, is as much for adults or older children as it is for kids. I think kids often miss sort of the nuances of Grandy's loss and her grieving process. But I find, like, when I've got people who have someone die in their life, I will often buy them Tear Soup and give that to them as a present. And Phyllis Silverman was one of the authors of the Harvard Child Bereavement Study. A book that I didn't include in here is called Never Too Young to Know: Death in Children's Life. That was also by Silverman. I don't usually recommend that for families. It's like 300 pages or something, but for anybody professionally supporting grieving kids, I find that Never Too Young to Know is it gives you a really good basis for whether you're supporting a child dying themselves or a child who's grieving somebody else's death. But this is her book that is designed specifically for parents who are raising grieving kids following the death of somebody in their life. Next slide. So I realize that this section's not going to be applicable to anyone, but anyone who is living in states where euthanasia or physician-assisted suicide has been legalized, and certainly this is the case across Canada now. I thought I'd at least just touch on some of the resources. There's not a ton, but some of the resources that are out there in terms of medically assisted deaths. So the Dr. J Children's Grief Center has very recently just launched. They've got a whole page. It includes a video of one of their counselors, actually role modeling with a youth a conversation about a medically assisted death. So it's an excellent resource. Canadian Virtual Hospice, actually, that might be on the next slide. If you can go ahead to the next slide, Victoria. In KIDSGRIEF.CA, this was through Canadian Virtual Hospice, we included a whole chapter on medically assisted death. So I'm just in the process of reviewing all the videos that have gone on that. So while KIDSGRIEF.CA is stocked full of videos of families and professionals talking, we don't have the videos posted yet, but they will be very soon in the MAID's chapter. But certainly the written content is there, just walking through how to talk to kids about a medically assisted death. And then on my website, I have a webinar. It's a 90-minute webinar on talking to kids about a medically assisted death. It was really, I'm going to update it soon. It was really designed as much for professionals as families, simply because I've been working with a lot of professionals, sometimes the physicians who are going in to actually administer the medications at the end of life, and have them be really caught off guard when, there's a grandchild or a child in the room as well. And I don't think anybody's had enough experience now. We don't have research, certainly, or any long-term research in terms of this area, but certainly for the handfuls of families that I've worked with where it's been a medically assisted death, the principles have been very similar as any other type of death in terms of the importance of being honest, giving kids options. If the person dying is open to having a child there and the child wants to be there, preparing them for that. So this webinar sort of walks through a bunch of those pieces. I've included a few resources here for overdose and substance-related death. I was looking through a bunch of resources because certainly I'm working with a lot of families right now who have experienced overdoses. And some of the resources were incredibly laid out and the formatting was beautiful, but they didn't actually give families information about how do you talk to a child about this. So I do like this one from Our House. Our House, I believe, has got several locations in California, maybe all in LA. But I think that their tip sheet is well done in terms of actually giving families the language of talking about overdose to kids. Many of these pages, because we will send out the handouts to everybody who's registered for the webinar, I actually hyperlinked them. So you should be able to click on the picture of Our House, and I believe if everything's working as it should, it would direct you right to that specific tip sheet. The Dr. J Children's Grief Center also has a pre-recorded webinar that's coming really soon. They've been working on a big project around substance-related deaths, and so there'll be a number of things coming out soon. But one of those resources is a pre-recorded webinar on supporting children and youth grieving a substance-related death. So that'll be available right on the Dr. J Children's Grief Center website. So stay tuned for that. So I've also included some of my favorite go-to resources for a suicide death. A lot of them are books. There's some tip sheets as well. This is actually a great video. I actually just came across it recently. It's not so much for grief support related to a suicide death. It's actually more about suicide prevention. But it's through the Mayo Clinic in the States. And I think they did an excellent job. And they just really break down, sort of the language that we can use to talk to somebody or to ask somebody. And this is something that I'd really encourage, anyone who has the opportunity to go into schools or support youth, within groups and things like that, to consider, sharing this video with them. I think they really nailed it. One of my go-tos has always been CAMH, the Center for Addiction and Mental Health in Toronto. They've got a tip sheet. It's now not so much formatted as a tip sheet, it's a web page, but on when a parent dies by suicide and ways of talking to kids about it. I mean, it doesn't have to be a parent. It could be a sibling, it could be an uncle, it could be a grandparent. So I direct a lot of people to this tip sheet. The Dougie Center, again, I mean, they've just got everything. So they've got tip sheets online, some that can be ordered for organizations as well on talking about suicide, but they've also got, this is one of their workbooks for kids who are grieving a suicide death. And again, anything through Winston's Wish, the Dougie Center, it's going to be phenomenal. They're going to be phenomenal resources. This is Winston's Wish, Beyond the Rough Rock. And now this is actually specific for an adult who's supporting a child who's dealt with a suicide death. So it gives adults a lot of the language and ways that we can actually talk about it, which I think is so helpful to actually have some guidance on how to talk about these things. So a few resources here as well. Deaths Due to Murder, Dougie Center again, and Winston's Wish are my big go-tos. So Winston's Wish has a whole page. They've also got a documentary. I couldn't quite figure out how to watch it. So maybe you have to be in the UK to watch it. I'm not sure, but they've got a documentary about supporting a family through a homicide. Another thing to keep in mind in terms of Winston's Wish documentaries is the Mummy Diaries. And so that's available for free on YouTube. And that's actually for anyone who supports families before a death happens. This is the story of Julie Stokes, who's a psychologist who actually was, I believe, founded Winston's Wish. Julie Stokes was working with a number of families, all of which the mums were dying, and she's following these families and helping the mums and the families prepare for the mums' deaths. So that's a great resource as well that can be found right through YouTube. You have to get the right, I put Mummy Diaries Winston's Wish, or else you're going to get a whole lot of stuff that is not the right kind of mummy. And so next slide, I think, is probably a Winston's Wish book on, oh, no, it's Dougie Center. So Dougie Center, this is one of their tip sheets that you can just print off as a PDF, supporting children and teens after a murder or violent death. And these are the things, you know, I think it's important because I know we've probably got a mixture. People are here for professional reasons and personal reasons. You know, when it comes to whether it's an expected death, whether it's an unexpected violent death, I think it's really important that we keep in mind some of these tip sheets have been really designed for parents. Some are designed for everybody, but it's important, I think, for any of us who are professionally supporting families. I'm always trying to resource the families when possible with this. We shouldn't be the first one telling the kids that it was actually a suicide or it was actually a homicide. We should really be working with the families. So on the front lines of whether you're working at, you know, in mental health centers or if you're working in schools, bereavement centers, having these available to give you the guidance of the language to use, but not interpreting it as our place to initially be breaking that information. It's really, we want to be resourcing the families and encouraging them to have those conversations. But this can guide us in terms of what language to guide them with. And Dougie Center has After a Murder. And again, this is actually a workbook for grieving kids as well. So I've included just a few resources here for preparing for funerals, memorials, and other ceremonies. One is Dr. J Center. Again, they've got a great tip sheet on attending funerals, memorials, and other rituals. Myself and my good friend Mishi Methvin wrote, it's a much longer version. The Dr. J one is about, I want to say it's about 4 pages. The one that Mishi and I wrote is much longer. It goes into more details, such as, you know, if kids want to touch a body, explaining how the body's going to feel different. It might be cold. It might, you know, probably feel not as soft as it normally did. I find one of the things that often will trip up families, a lot of families will be like, okay, well, we'll bring them to the funeral, but we won't bring them to the burial because that'll be way too hard. So we walk through too, like if they do want to go to the burial, how, and I always say to parents, like, don't assume that the kids won't want to go. Because in my experience, most kids want to be at the burial. Certainly if they don't want to, I'd explore the reasons they don't want to, you know, what's holding them back. But I would never want to say to a kid, like, you can't go to your dad's burial. And I think that's often adults and reflective of our anxiety, thinking it's going to be too hard for them to see dad buried. But I can guarantee if we don't allow them the opportunity, if they want to be there, they will imagine it worse. So Mishi is actually the bereaved parent. Her 3-year-old Stella died of cancer. But she is also a funeral director. And Mishi, and we address this in our printout as well. And so you could just, when you get the slide, you can click right on this link. It's actually on my website. But we actually talked about as well, you know, in many parts of the world, it's customary for people to actually view the cremation happening. There's more and more places, I know, certainly in the Greater Toronto area, that are actually, or funeral homes that are building in sort of witnessing areas. If people do want to view sort of the cremation, not that you see very much, but and Mishi certainly talks about how she's prepared some kids to come in and sometimes even like press the buttons and things like that. And so we sort of go into a lot more detail about that. So resources for grief support in schools. And one of the good news about schools is that there's actually a lot of resources. There's a bunch more coming out. A lot of the consulting projects I've been working on this year have all been school-based. Ottawa in Canada is doing a really cool project right now where they're looking at getting a shared level of grief literacy into every level of the school board, which is so great. So there's presentations we've developed for educators, administrators, parents, students, and counselors in the schools. So this is actually, if anybody wants, because Barry Ashpool, again, was involved in this literature search, he amalgamated all of the literature worldwide about grief in schools, looking at both grief education. So this is not about, or death education. So this is not about like when a death actually happens, but actually being proactive and weaving it right into the curriculum. And also grief support. How do we support kids, you know, when a death does actually happen? So this literature search is amalgamated. It's totally free. It's at that link on the Compassionate Ottawa website. One of my favorite go-to resources, this is the US website, the Coalition to Support Grieving Students. They have all of these different modules, both for, I believe, administrators, educators, administrators and educators, I want to say. But anyway, they really break it down to a number of different groups who would be using it and needing the information. But they also break it down so you can just print off like these brief tip sheets. They're also the ones who they've got a phone line. We can't use it in Canada, so I've never had the opportunity to use it, but if anyone uses it in the US, I want to know, like, is somebody there live? How quickly do they get back to you? But basically, like, they do have a 1-800 phone line, and it says like it's for anybody in the US who's trying to figure out how to do grief support in schools, and that you can call and they will help resource you. And I love all of their material. Sometimes there's pieces that I find that a certain school board suicide policy might be a bit different than the Coalition to Support Grieving Students. So there are some differences that we sort of have to have on our radars. But overall, I think that their content is excellent. This is a video series that the Retired Teachers Association of Retired Teachers of Ontario funded through the Children and Youth Grief Network. It's literally me standing in a classroom talking about how to support grieving students. There's about 4 or 5 little clips. So they're all free. They're on the CYGN website. And they're about 4 to 5 minutes. So really designed with the idea that, you know, educators might only have 4 or 5 minutes to quickly look at a clip. So we had what to say, what not to say, 4 common concerns students have, and a number of other topics as well. These are a couple of my favorite new resources. The CYGN, Children Youth Grief Network, has just this year, I mean, this is really new, put out the Grief and Death Education Toolkit. So it was really designed, and Victoria, you can correct me if I'm wrong here, I think it's grade 4 to 10, and it weaves into the Ontario curriculum. But certainly I know we've got a ton of people from outside Ontario as well, keeping in mind that it doesn't need to be, so much of it can probably apply to any curriculum. And that's where it's completely free. If you want the hard copy, you do have to pay for the shipping. But for the PDF copy, I believe you can just get on the website. This is where Victoria is going to jump in and correct me if I'm wrong about any of this. Is this right,
No,
Victoria?
you're totally correct. Yeah. I just wanted to say that it does have detailed lesson plans incorporated into the toolkit. So for grades 4 to 10, alongside the Ontario curriculum, there's ways to incorporate death education into science conversations, history conversations, geography conversations. It's ways to sort of weave in death education into any subject that you might be teaching, from sort of primary years right up to the senior high school.
Which is awesome. I love when I came across a kindergarten teacher recently and they'd found a dead bird in the yard and they were like talking about the dead bird with the kids and stuff. And it's those teachable moments too that I just think are so important. And I really think if we did weave more sort of death education and general grief education, you know, and grief isn't just specific to death, it's any big significant loss. If we wove more of that into our curriculum, I think that there'd be a very different landscape for when people are grieving like the biggest losses in our lives. The other one is a book through Oxford. This one's not free. I don't even think it's cheap. I can't recall how much it is. But it came out last year, and I'm a bit biased because my colleague Lisa Toy and I did write a chapter in it, but I thought that they did a very good job. It basically breaks out when you're supporting grieving students at school, you know, different things. Like the chapter that we did was on using writing activities that could be done to support. I know there's a section on play therapy, on art activities that can be used to support children's grief. This one would be really good for like counselors, social workers in the school as well, who actually have more time to just be working individually with the grieving student. But I think for educators as well, there's probably suggestions around classroom work. Loss, grief, and growth it's actually it's a gem that I feel like somehow has slipped through the cracks. It's an Ontario initiative. It came out a number of years ago. It was, I believe, a combination of the funeral industry and a few schools, and basically it's bringing grief education right into the school, talking about the teachable moments, but also how do we support kids after a death. It's bilingual, so there's a French version, there's an English version. It's a great resource. I believe it's available for free. So I just, yeah, I don't know why it's really slipped through the cracks, but I reviewed it this year and I was like, huh, this is really good. I really agree with all the language that they're using. And Start the Talk, I had mentioned earlier. This is about talking to kids about cancer. Again, they've got the section for educators, section for healthcare providers, and it too is French and English. So I've just included a list of a bunch of other resources here. I know for the Dougie Center, I don't know that the educating ones in particular, but a number of the Dougie Center resources are available in Spanish as well. So for the US, well, for anyone actually who's supporting anyone who would prefer their resources in Spanish, the Dougie Center would be a really good place to go for that as well. So I'm just going to do a little bit on some of two of my favorite resources for young children. And when I say young children, I'm talking kind of preschoolers. I find that, you know, our 1, 2, 3-year-olds, they often have what we call disenfranchised grief. People don't recognize their right to be a griever, or we're quite quick to say, well, they're too young to even understand. And one of the things I find with young children is that they really understand more than they're able to articulate. So unfortunately, they often get missed. Sesame Street, I mean, they researched the heck out of everything and they did such a good job. So they've got When Families Grieve, again, completely free resource. It's available. You can just Google it. It's on YouTube. But Elmo's uncle dies. They use all the right language. There's no euphemisms. It's all death, dying. Elmo, I don't know how old Elmo is. Maybe he's about 3, but you know, as per many 3-year-olds, he like understands it and he's like, okay, I get it. My uncle died. And then he forgets like a couple days later, right? So he really fluctuates in that understanding, and everything needs a lot of repetition, but they just nailed so many aspects of grief. And I like that the in-between sections are, they have these interviews with Katie Couric, talking to many people, families who are grieving. A number of the families had people die in military deaths or in 9/11, and those are often older children. So I find that even though Sesame Street is clearly tailored to a younger population, I find that you can have families with, you know, big age spread of kids that this will resonate with, because the older kids, you know, really resonate seeing real live kids who have also experienced the death of somebody in their life in Katie Couric's interviews. And this tip sheet I probably send out every single week to people. So this is, again, the Dougie Center, totally free, but it's supporting grieving preschoolers. And so it's really looking at, you know, our 2, 3, 4, and just so many of the same principles to supporting kids in general who are grieving, but I like that they've really broken it out for grieving preschoolers. And I think it just helps people feel more willing to enter that space and have these conversations with even really young kids who aren't going to necessarily articulate understanding. I always say, you know, even if you've got a kid who's 1 year old, 18 months, they're not going to know what cancer is, but you're still better off saying mom has cancer as opposed to mom is sick. That kid's going to grow into an understanding much faster that, you know, what mom has is different than the cold or the flu that goes around daycare if we're using the right language right off the get-go. So I've also included some resources for teenagers. The cool thing about teenagers is that if they don't find enough resources for themselves, they often create them. So a couple of the resources I'm talking about, I'm going to show you about, were actually created by teenagers. This one is Winston's Wish. Again, it's a great, they've got a whole subset of their website called Help to Make Sense. All kinds of free little videos and stuff about teenagers who are grieving. This is a print off like PDF. And I will often say to families, like, I'll print it off and just say, you know what, just don't force your teenager to read it, but just leave it around the house. There's a whole bunch of good information in this one-page tip sheet. Not a tip sheet, but graphic sheet, I don't know what you call it, that really, you know, sort of normalize grief and also give strategies for kids, for teenagers who are trying to support other grieving teenagers as well. Slapped is surviving life after a death of a parent or after a parent dies. This was developed by teenagers for teenagers. You have to register and get right into the website. So I've never done that, but I know I have had some teens who have found this really helpful. I've had a few who've also found it not so helpful. So I think it can be hit or miss. But I did listen to a podcast with the people who created it, and it was phenomenal. So I think that's a great resource to let teens know about as well. And Cancer Really Sucks, website designed by teens for teens who have somebody with cancer in their world. Dougie Center recently put out this deconstruction reconstruction, again, not free. For those from Canada, I find it a bit tricky to get some of these things shipped over the border, but certainly for the folks in the US, or if you're going to visit the US, like I would order a bunch of these. So I've just sort of browsed through it online, but looks great. And I have no doubt it is great because it's coming out of the Dougie Center. And Chill and Spill, also through the US, Art with Heart. This isn't a death specific or a grief specific journal, but it's very much designed for teens dealing with really difficult issues, including trauma. Again, doesn't have to be death specific. So I'm just going to touch on 2 resources more specifically for clinicians here. This first one is from Leanna Lowenstein. It's Creative Interventions for Bereaved Children. Leanna Lowenstein's a wonderful social worker and play therapist in Toronto. And she's got a ton of free articles on her website, actually. So great website to check out. She's got all kinds of free articles, including like tip sheets on how do you talk to your kid about going to therapy and help them understand that it's not because they're bad or anything's wrong with them or anything else. So really giving families the language, but she's got a whole section for clinicians as well. But I use this book a lot, Creative Interventions for Bereaved Children, which you can purchase right through her website. This next resource is by Stephen Fleming. He's a psychologist also here in Southern Ontario. And a lot of Stephen Fleming's work has been really focused on parents who have had a child die. And so this book is specifically, it's a practitioner's guide. It is for clinicians, but it's for practitioners who might be supporting bereaved parents who, you know, have surviving children as well and are figuring out how to integrate their grief into their lives and their families' lives in the healthiest way while supporting their grieving children. So just a couple hot things here on what to say and what not to say when someone's grieving. I'll just do a quick run through these, but I love this clip. So Megan Devine is a psychotherapist in the US. I believe she's in Oregon. She was already a psychotherapist. Her partner, Matt, died unexpectedly through a drowning. I really feel like Megan is changing the discourse that we are having about grief, death, and dying in our society. So this is a 3-minute clip on what to say and what not to say for someone who's grieving. It's free. It's on YouTube. It is brilliant. She nails it. I use this now in schools and healthcare, wherever I'm teaching, and often will send it to people in my practice who are grieving and really finding themselves in a position at the time they have the least energy for it, but to be teachers of the people in their life who are struggling to know how to show up for them. I love this website as well, Help Each Other Out. It has sections on, people, if you're supporting someone struggling with infertility, war, breakup, unemployment, all of these things. Again, sort of the what to says, what not to says. So I'm going to finish up. I've just got a couple more categories here, and then we'll open it up for your guys' questions. Please don't, I can see we've got some questions, but please don't hesitate to start putting your questions in and not wait for me to actually finish talking. Helpful activities. Children and Youth Grief Network has a phenomenal series. So they've got a handbook for supporters. So these are more designed for professionals or volunteers who've had some training in working with grieving children and youth. They are totally free. Victoria, do you want to jump in and talk about them?
I just wanted to mention, only because of the titles, sometimes they can be a little bit confusing, but the green book on the far left, the Handbook for Volunteers, was the initial publication. And we realized that that book was really more oriented to children under the age of 12. We also just released that book in French, which is the blue book in the middle. So all of those incorporate activities for sort of younger children. And Handbook for Supporters, the purple on the right, is the new book that we released, I guess, early last year. And that's for children ages 12 to 18. So much more focused on teenagers and youth. They are, I believe, free to download from our website in terms of an electronic copy. However, again, if you want to request a hard copy, those are paid for shipping. Yeah.
Thanks. So yeah, those are often my go-tos. There's tons of great activities in there. So we'll just sort of finish up with some books, webinars, and podcasts. This first website, I've only found out about it in the last year. I believe it's a bunch of like librarians in the US or something like that. I love the name, Not If, But When. And they've just amalgamated a whole bunch of books for young people about death and loss. So not just specific to death and dying, but any type of significant loss. So I love this website. I haven't read all of the books, but certainly a lot of my favorites are on there. Winston's Wish, I just did a little snapshot here because they've got books for like kids of different ages. The Secret C is about cancer, more for the tween group. But I mean, they've just got sort of everything covered: homicide, suicide for the adults, for kids doing activity books and things like that. Out of the Blue, I believe, is for teenagers. Dougie Center, again, just gives you a snapshot. And again, just as a reminder, a number of those books also are in Spanish. I really love that for schools, they've also got a book specifically for administrators. I've got a number of webinars on my website as well. So I just put a little clip here. They're all $19. If it's ever a financial barrier or whatever, just let me know and we'll still send them out. And Dougie Center has Grief Out Loud, which is their podcast. And I spend all my time now listening to Dougie Center podcast when I'm in the car. And so you can see the first one up there, when the love of your life dies of an overdose. Great topics. They do a wonderful job. And I'm just going to finish with bereavement camps. I realize that we have people from all over the place, so I didn't get too specific with the camps. I mean, Camp Erin is all over, not all over Canada, it's all over the US. There's a number in Canada. There's also a lot of other bereavement camps that aren't Camp Erin. There are many camps, that are free. And so like Camp Erin. So I think it's always good to check in with your local hospice, find out if there's any bereavement camps. I included Camp Carey here. Camp Carey is mostly in British Columbia, but they've now got one in Ontario and New Brunswick as well in Canada. They're a pay what you can model, but I believe nobody is turned away. And the reason I highlighted Camp Carey is because I think it's such a phenomenal concept, and I hope more people do this. But it's a family camp. So if you've had a parent die, the surviving parent and the kids come to camp together. So I think it's a fabulous model. But I do find that, you know, quite often families who might not be able to get their kids to individual counseling or might not be able to get their kids to a support group, you know, do find a way, and we need to help wherever we can, but to get their kids to the camp drop off, because it also gives a surviving parent a weekend or a week or however long the camp is on their own as well. So I find camps are such a powerful way to actually be able to provide services, sometimes to communities who otherwise wouldn't get them as well. And I've just closed off here with the general resource. I mean, this is specific to Canada. Most certainly the US, most countries have their helpline, but Kids Help Phone, I give across the board to any family or kid that I'm working with in Canada. And they've launched recently their text to connect, and apparently it's gone gangbusters. Far more youth and children are reaching out that way. So that, I believe, sort of closes off the actual resources. I love that there's now Children's Grief Awareness Day. So I believe it's the first Thursday after American Thanksgiving every year. This is the website. They're already doing the countdown till next year. I find November is one of my busiest months now because a lot of organizations and a lot of places are doing Children's Grief Awareness events. A lot of those events are free to family, but they have all kinds of resources on their website too about Children's Grief Awareness Day, and really just, again, getting that information that we've got the research. We know in general, broad scope, what benefits grieving kids. We know it certainly doesn't benefit them to exclude them or not be honest with them. And how do we get that information up to the front lines who are supporting kids? And I think they're going a long way towards doing this.
I just wanted to highlight here, I know some of you may be connected to Andrea, but just in case anyone was looking to connect with the Children and Youth Grief Network, we have our website, our main email address that you can reach us at, and then we are on Facebook, Twitter, and Instagram, and we do share all kinds of updates, not only from Andrea, but from all 10 of our network partners, as well as other community groups that we're sort of aligned with. So feel free to check us out. We have a lot of different resources coming up that will be made available soon and over the summer, so stay tuned for some of that. And so I think that's it. So we'll just move into questions and comments. Andrea,
it's great to see everyone's discourse.
Yeah. Andrea, I'm just going to go through some of the questions that are here. I'm not sure if you can see them on your end. Leanne Shapiro is asking, do either of us have a recommended intake or assessment for children who are grieving?
So to be honest, I mean, I tend to use, Dr. J had one that they would use, and I've just been using theirs ever since I left there. But that's more for the intake when, like, I'm bringing them in sort of to see me for private practice. I think a lot of organizations, because a lot of our intake is actually done just in a conversation over the phone. But I think a lot of organizations do have intakes that are like sort of more manualized, and I don't know, Victoria, like, I don't know if CYGN has one, or the HUG program, or ones that they're willing to share. Mine actually isn't that helpful.
So I also, in addition to working with the Children and Youth Grief Network, I do also work with Dr. J, Children's Grief Center. And so, as some of you know, like, our intake process currently is closed, but part of that is also our revamping of the intake process. So we are hoping to have a little bit of a different intake process, a bit of a different form, different assessments being incorporated. So depending on when that launches, I mean, I know Dr. Jace has always been great about sharing some of what they do and how they do it. So that would be something I would check in around in a few months' time. And then part of the research project that I was speaking to earlier in the presentation, some of the stuff we're hoping will come out of that from the Children and Youth Grief Network is, maybe an example of some questions that can be asked in an intake process to facilitate some of the conversations around social identity and marginalization. So we don't have anything in the works yet, or like ready to go, but we're hoping that it is something that comes out before the end of the summer. So hopefully that answers your question, Leanne. Another question from Pauline. Oh, sorry, go ahead.
Well, I was just going to say, I believe Leanna Lowenstein's book on creative intervention or for supporting bereaved children might address intake as well, because it is designed for clinicians, and I feel like she's got a fair bit of that information in there as well. And yes, I can see Paulina's question as well about Dr. J's. You know, the thing with Dr. J's and the HUG program, it's so unique to have programs that, again, work with families on an individual basis and before a death. I actually don't know of any similar Dr. J's anywhere sort of in for the GTA. Victoria, why don't I sort of hand this over to you? I'm not too sure what you guys have been
Yeah,
telling
we
people.
are also
Waitlist.
like, I'm going to say that Dr. Jade's is a bit unique in the way that we do some of our work and the variety of programs and services that are offered. So in addition to one-on-one counseling, we are really getting going with some family resources. So we have a caregiver support group. We have a concurrent children's group that's happening. We have a middles sort of art therapy group for kids who are 9 to 12. And then we have our youth group and the LIT program for children ages 12 to 18. So we've got like a whole host of stuff. Unfortunately, yes, we do sort of remain close to new referrals, but we are hoping to be open very soon. So just stay tuned for that. I mean, we are sort of directing a lot of our referral processes, I mean, to Andrea and some of our favorite sort of other clinicians, private clinicians, who I appreciate it can be a bit challenging in terms of financial resources and insurance processes. But Lisa Toy, psychotherapy, who was one of our counselors at Dr. J's, has sort of begun her own private practice. So she's wonderful in her orientation to grief. And then Bereaved Families of Ontario, the Toronto chapter, very close to our offices as well. So we've sort of begun to really like align and partner with them in the interim. They don't do a lot of one-on-one stuff, but they do have groups that can serve folks' needs in the interim. Yeah.
And I just saw, I'm actually looking on this side panel there, and I think this is a resource I should have actually mentioned and didn't even think about. But Laura asked, are there trainings you would recommend for clinicians working with children, youth, and their caregivers? So one of the trainings, one of the main trainings that I'm involved in is actually a 5-day that we do through Sick Kids in Toronto a couple times a year. We just ran it last week. So it's 5-day program for children's grief and bereavement. It's a certificate program, and it can be taken, each individual day can be taken on its own. One day is before a death, one day is after a death, one day is specifically Lisa Toys there doing, you know, creative interventions through art therapy and things like that. We have Leanna Lowenstein come, and she does, you know, how do you recognize traumatic grief in kids? A number of people come and talk about, you know, how do you support somebody on the autism spectrum who's also grieving? I mean, this is a program that we've traveled with. This is where I had the pleasure of being in Louisiana with Denise and the people that she works with at the hospice earlier this year. We're just launching this 5-day in Guelph as well. So first week of November, we'll be holding it in Guelph this year as well. So not to say that there's not other trainings. Quite often there are like one-off trainings from people with expertise in the area of children's grief and bereavement. I know the Lighthouse program in Oakville does a symposium every year as well. But I feel like the 5-day might be one of sort of the most comprehensive ones that I've at least come across. Victoria, can I direct this Daniel's question to you about, I work with queer and trans youth. I'm wondering if there's any research into grief in this population, particularly for folks who were not able to come out to a loved one before their death.
Yeah, so it's a great question, Daniel. Thanks for asking. One of the challenges that I had in researching some of the marginalized groups, including LGBTQ communities, is that there's a lot of stuff that's sort of happening in some of these communities. And when I say a lot, I mean a lot compared to what has happened in the past. So more now than ever before. However, a lot of the research on LGBT communities are actually focusing on middle-aged and elderly populations, which is actually quite fascinating. There isn't a lot of research to date on LGBTQ youth specifically and strategies to support that. Interestingly enough, the conversations that you're wondering about in terms of coming out to family members before a death is something that is still being talked about in the adult populations, a lot around disenfranchised grief. So even if someone had come out, folks in their community, their networks, their family and friend circles, not really recognizing their grief as valid, So I'm happy to share some of those links with you. Our literature review will be made available hopefully before the end of June. So stay tuned for some of that. But unfortunately, yeah, there's a huge gap around any of these, intersections between marginalized people and youth specifically. So it's definitely a gap that needs to be filled.
So we're down to our last few minutes. I'm just want to see if there's any questions that we've missed. Are there any particular resources for discussing spirituality with grieving children and youth? I mean, one of my go-tos, now this would be more specific to young kids, and this just touches on it. I can see a number of people were commenting here about how much they love When Dinosaurs Die. I mean, one of the things with Dinosaurs Die is that it does, in the last couple pages, talks about all these different beliefs that people have. And I think that's a really important way to sort of approach it, most certainly when we're coming from a professional or volunteer standpoint of supporting kids. So I'm always very careful to be cognizant of the power dynamic and not putting any certain belief system onto children. But even when I'm coaching parents on how to talk to this, I encourage the use of the word mystery and not being so absolute. I think one thing that we do that sometimes trips up adults is that we think, well, we need to make the afterlife sound really great because it'll make the kids feel better about the fact that someone's died, not realizing that, the other side of that is sometimes we get kids saying, well, I want to go there too. And that taking more of a open, we don't know for sure approach can be really helpful. All of that to say, I'm sure there are books out there. I've not really seen books come together with talking about death and dying in general and spirituality. I think a lot of them, resources that I use are most certainly, wonder with kids. Don't give them absolute answers. Victoria, I don't know if there's anything that comes to your mind.
No, I think that's probably the way I would have responded to that as well. Yeah. Just looking through Santina's question around military families. So military families were not something that we had focused on, or at least in my part of the literature review. I'm not sure if Andrea and Barry came across anything. I just wanted to flag for folks that recently Dr. Jays had attended the Vanier family conference in Ottawa. I guess that was the end of March. And we've been invited to be part of a panel on military families specifically. So we're hoping that that partnership will sort of develop so that some more information can be offered around grief in military families. The Vanier Institute offers a lot of really wonderful and comprehensive information on military families specifically, but they are sort of looking to build out their resources for grief. So stay tuned for some of that. Andrea, I'm not sure if you came across anything else.
In the research, I feel like it was probably touched upon, but I do know that some, certainly either or both of Winston's Wish and the Dougy Center have specific resources for military families. One, I think it's called The Family Has Been Informed. I want to say that's Winston's Wish, but it's going to be one of those two organizations. Absolutely. And I think there are some things that I know I've come across specific resources to military families. It's a really good point. I think next time we do this webinar, I'll make sure that we actually have a section on that, because there's not an abundance of resources, but there are some, and they address the additional losses that often people are, having to deal with, which might be moving off base, moving out of their community, and everything else as well. So I'm really glad that question was asked, and absolutely either or both of Winston's Wish and the Dougy Center do have specific resources to military families. I know we're up against our time now. I know Jennifer was asking for clarification when we are mentioning youth, which age range is that? I think right now, because we're talking about a lot of resources, and I find organizationally different organizations sort of frame youth at different ages. So I don't think we, for the purposes of this webinar, have an absolute one. When I speak of youth, I'm often sort of talking about like 13 up to even young adulthood. I know some places cut off at 25. What is CYGN? What's the Children and Youth Grief Network cut off? And what do you guys sort of define as youth?
Yeah, it's a bit tricky because we are sort of a conglomerate of organizations. Every organization also defines youth differently. So like their youth group is open to different age categories and things like that. When we put out our resources, like our youth handbook, the handbook for supporters, we are focusing primarily on kids who are ages 12 to 18. But I would say that there's probably some flexibility within that, and that you can go a little bit older and probably a little bit younger as well. But that's sort of the definition we've used for any resource we've published directly through the CYGN.
So I think we have to wrap up, but I'm just going to really encourage everyone, if you haven't already, please make sure you scroll through the chat box. It's so cool to hear about all of these different resources, some of which I knew about, but we just didn't have space or time to highlight, and some I've never even heard of. So really cool. It's part of what I love about this platform, and that it's all these people coming together and we facilitate it, but really we're all able to share our wisdom and the resources that we know about. And I think that one of the things just to keep in mind is, you know, there are phenomenal resources out there. I love what's happening in Denmark in schools. I say it's Denmark and it may be Norway, but I think it might be Denmark, where they have the bereavement response plan, right? And the vast majority of educators feel equipped to deal with bereaved children, students in school, as opposed to the United States. And I'm sure Canada's stat is the same. 90% of educators don't feel equipped to support grieving students in school. So I really encourage anyone who's coming from an organizational standpoint, don't feel like you have to reinvent the wheel, right? The family bereavement program, which we didn't highlight, but is actually a really important piece of the literature. It was from the Southern United States, phenomenal children's grief program, and one of the few ever that also had a control group, very much focused on supporting surviving parents and supporting kids after the death of a parent. And they've got their 11-year study results coming out. Some of that will be in the literature search that will soon be up on the Children and Youth Grief Network. But they're still seeing really positive results 11 years after this sort of 12-week group intervention that this family experienced over like half a year. And I think it's so important to know that these things exist and that we don't need to reinvent the wheel and start again. So I really want to thank everybody so much for coming together and being able to share the resources that you know of. And it's been so lovely to have the opportunity. Like, Victoria is passionate about the research. I really don't know a lot about the research, but I love knowing it once it's all amalgamated, and to be able to share the resources that I get really excited about as well. So thank you so much, everyone, for being here. And we will get the link for this webinar out to everybody who was registered for the webinar.
Yep, we will. Thank you so much to everyone for coming. And I just wanted to address Morella's question. I believe that the follow-up emails that come after this webinar detail certificates of completion, but if you don't receive one or would like to request one, feel free to email us at this email here, the info@Children and Youth Grief Network, and we can make sure one gets to you. Awesome. Thanks, everyone.
Thanks, guys.
Take care.